Welcome to the Heart Rate Variability Podcast. Each week we talk about heart rate variability and how it can be used to improve your overall health and wellness. Please consider the information in this podcast for your informational use and not medical advice. Please see your medical provider to apply any of the strategies outlined in this episode. Heart Rate Variability Podcast is a production of Optimal LLC and Optimal HRV. Check us out at optimalhrv.com. Please enjoy the show. Welcome, friends, to the Heart Rate Variability Podcast. I am here today with a really exciting guest. Got to meet her recently. Just both a ball of brilliance and joy is the best way I can describe my interactions with her. So, Dr. Sarah Gray, welcome to the podcast. I'm so excited to have you here today.
Thank you so much, Matt. Really so excited to be here. Thank you for having me.
Absolutely. And I got to know your work a little bit, but I'd love just to give a quick introduction of yourself for our audience.
Sure. Yeah. So I am a health psychologist in the general Boston area. I currently work at Massachusetts General Hospital in the behavioral medicine department, where I get to work with trainees and train the next generation with biofeedback related pieces, and also help patients with these tools. And then I also am an instructor with Harvard Medical School, where I get to do some additional training and education. And then I have a private practice in Arlington, Massachusetts, in the greater Boston area, where I do a lot of work with general psychology, health psychology, and certainly a lot of biofeedback and neurofeedback pieces.
Awesome. Looking at your website as we were looking at here, and I know you work with other professionals as well, but the offering of therapeutic services that you do offer it's just really impressive. I'm like, boy, I don't have any family in Massachusetts, but if they needed therapy, I would definitely, because whatever they would need, the high level of both your team and your services is just incredibly impressive.
Thank you so much. It's a real part of my philosophy clinically. I believe firmly in having a well-stocked toolbox. And so my approach is really, not one size fits all. So I want to have plenty of tools. I can't have all of them in there, but the ones I can have and have trained in, including biofeedback being a big one of those, so that I can pull out whatever's right for each person and really tailor that to their needs. And it's something that I love doing.
I love it. And so with all that training you have, and you didn't even mention Oxford. I was looking at you. I was joking with you before our conversation started. You have basically the best brag bio I have ever seen. And you're very humble about it. But if you want to list maybe the top 20 organizations in the world, you probably got 5 or 6 of them in here. Being in Boston doesn't hurt, but still very impressive. So I would love to hear, kind of within all your expertise, all your training, when did heart rate variability start to make your radar?
Yeah. So going farther back, I had a different career path earlier on. I came to being a clinical psychologist a little bit later in life compared to the average track. And I had been really interested in health and wellness and ways to optimize those things. I was kind of looking at different pathways, and I was thinking, maybe med school, or kind of integrative approaches to medicine. And in that process of interviewing people to find out what pathways might be there, I met a health psychologist in Portland, Maine. And Maine is where I grew up, so I have some connections there. And she had just casually mentioned, as part of her role of things that a health psychologist might do, that this biofeedback thing might be part of it. And this heart rate variability biofeedback was something that she had experience with. So I went home immediately. I was kind of nodding along at the time. Oh, interesting. And what is this? And that conversation and really knowing that there were some neat tools that fused my interest in physiology, anatomy, medicine in a way into, this use of psychology and health tools really cemented that. And then later on, when I began grad school, I chose my grad school, which at the time was called Massachusetts School of Professional Psychology here in Boston. It's now called William James College. And I chose it specifically because it was one of the only ones in this New England area that had a health psychology track in
Yeah.
particular. And we had someone come and give a presentation that showed some different forms of biofeedback, and I was enamored. So I just could not get enough of it. Sought out internship training locally that had it, and here I am.
That is awesome. And I
Yeah.
wonder with all this, those expertise that you've developed, I'd just be curious for you is HRV biofeedback. I'm sure, integrative psychology. I bet I know the answer to this, but so maybe the question is how. I'm assuming that HRV biofeedback is not necessarily an isolated service you offer, but kind of integrated into others. So correct me if I'm wrong with that assumption, but I'd love to if I'm right. How does that? How do you do that in your work?
Yeah, absolutely, Matt. Yeah, yes and no. Sometimes people come specifically
Just that.
for HRV in particular.
Yeah.
They've heard about it, or certainly there are patients who present, and in the context of an ongoing intake, it becomes clear to me that focusing primarily on HRV training, it would be beneficial for that particular
Yeah.
person. So that's not uncommon, but probably more, yeah, definitely more frequently is I'm using it as a tool to either begin, in a lot of ways, to begin with some concepts of even just illustrating that mind body connection that so many
Yes.
people are just detached from, and
Yes.
don't
Yeah.
don't have a sense of how much they can control it. They can learn to be optimizing, and or actually, it's interesting. There's someone I was just working with earlier today, where we've been working together for a number of years using some other tools related to trauma treatment, and we're at a point where we really came to see that she needed a little more help with nervous system regulation, and her older tools that she had been using before just weren't kind of doing what she needed to really be able to um, have that more control over what's coming up emotionally related to trauma. So we are shifting into doing a good piece of work with HRV training in particular, and then we'll return to some other therapies when that feels more balanced for her.
Awesome. Well, I wonder how with folks you like the example that you just gave us, how do you, because throwing just heart rate variability out there probably gets you some quizzical. I think everybody in the world obsesses about it as much as I do. But I realize most of the people still have not heard about this concept. So I wonder, like, as you work to integrate this into some of the other treatments, just kind of the psychoeducational pieces, how do you, because even parasympathetic, sympathetic nervous system might not be familiar with folks, especially if you're kind of like cut off by the brain stem and that separation between mind and body and the Western, misconceptions we have. How do
Yeah.
you sort of like, hey, I want to hook you up to this machine over here? Sometimes after it sounds like months, if not years of maybe more traditional kind of types of therapy.
Yeah, it's a great question. And yeah, usually we've at some point along the way talked at least a little bit about different physiologic aspects of whatever psychological problems we're typically working on. Although as a health psychologist, I will say sometimes people are coming to see me for more kind of separate physical issues as well, like chronic pain,
Yeah.
insomnia related pieces, perhaps some uh, yeah, brain injury and spinal cord injury related issues. So So it kind of, as always, depends on the patient, but and also depends on where the patient's at. Some people really do want all the information, they want all the science, they want all the details, and so
Right.
if that's the case, I'll spend more time going in depth or linking them in with some research. But generally, we're talking about, hey, as most people have a sense of, when we have any given emotion, whether it's we're working on some anxiety with someone or a trauma or depression, that's
Yeah.
going to have a corresponding response in the body, and that can come out in different ways. And there's ways that we can actually learn and train ourselves to have more control and balance over that, other than it just automatically washing over you
Yes.
sometimes. And so one of those ways that we can do that is this amazing tool called biofeedback. And then I go in. So I should pause and say, uh, I'm trained in most types of biofeedback. But by far, HRV biofeedback is my go-to. It's the one I use most of all for a lot of reasons. We could talk more
Yes.
about that, but it's just so applicable to so many cases. Um, but so I will talk about how biofeedback is an umbrella term. It includes different types of biofeedback that measure different types of physiologic output or expressions, and that that this is a way that we can start to visualize what's happening, because sometimes we get so used to our habits and patterns that we can't even uh, connect with what's going on in our mind or body, or how they're both talking to each other. And so this is a great way to visualize that. And then I show them. I feel like that's the best
Yes.
way. I just hook them up, get them on the HRV, which is so responsive. That's another reason why I love it.
Yeah.
And they can see for themselves. And that, talk about the most powerful way to teach anything, is they
Yes.
get to experience it.
I love it. So what are some of I just curious clinically, like some of the insights that you have had bringing heart rate? It sounds like it's maybe been there from a little bit of the beginning as far as your clinical, work with psychology.
Yeah.
Just sort of what insights, what have you learned over the years working with a variety of populations presenting problems? Well, what are just some things maybe that have surprised you that have interest you along the way?
So many things. Wow. Um, you know, I think first of all, how responsive it usually is. Um, I love being able to have someone give it a try, and we'll just play around with it
Yeah,
at first, just to kind of illustrate. And so for how powerful it is for someone to see, okay, just sitting here, we're not doing anything, we're not thinking about any deep topics, but
yeah,
let's just have a little bit of a thought of that stress at work that you were telling me about the other day,
yeah.
and then what happens on the screen with their patterns. And and then remember, some of those breathing techniques we've been talking about. Let's just try that. Let's just, play around that, and just how they can so quickly change that. And then I step back and I say, you don't even need to know a thing about HRV to
Yeah,
know what you're looking at on the screen right now. One is different than the other.
right.
And just see where that changed in real time. And this is what we can work on. It turns out you can really control that more. So the power of that, just that uh, seeing and experiencing it, and what that does to then motivation. So,
Yeah.
um, one of the examples I often talk about is, earlier on in my career, I worked with Spaulding Rehabilitation Hospital in a few capacities, and one of those was working with a chronic pain program
Hmm.
as a pain psychologist there. And it was a shorter term program, generally 8 weeks on average. And it was an interdisciplinary program. And the patients would rotate through a number of therapies and groups and classes. And a one-on-one meeting with me, they might only get to see me sometimes, two, three, maybe four times throughout the whole
Yeah.
program. But often,
Oh,
sometimes it might just be one time or a
yeah.
couple times. And to demonstrate, to use HRV in particular to demonstrate those changes, that they could see in real time and then learn to shift, often was the turning point for them. I often would have patients say, "Oh yeah, people have talked to me about all that mind body stuff, that breathing stuff, all of that
Yeah.
stress management, but until I actually saw it in my own body, I didn't, really kind of want to sit down and do all those breathing exercises you
Yeah.
talked about. But now I will," and they do, and they come
Yeah.
back, a couple of weeks later, and their patterns show it.
I love it.
Yeah.
I love it. And like when yeah, people have sort of this insight, that motivation piece, it sounds like really picks up there as well. But I'm kind of as in that rehab sort of setting with the and you mentioned the pain stuff as well. Just sort of what did you sort of see as you progressed with folks? And I know you didn't get a whole lot of time with them, but like what did you kind of see maybe shifts in their mindsets coming out of their work with you?
Oh, it's such a great question, because I think that almost is the biggest shift in a way, the shift in mindset, and particularly the sense of empowerment and efficacy. And
Yes.
when people have been living with chronic medical conditions, and especially chronic pain,
Yeah.
by the time they would get to our program, they had tried everything else. They had
Yeah.
gone through all the conventional routes, and so they were really often feeling very hopeless, very down. Definitely felt like, that there was nothing that they could do, or even, the brightest, doctors in the Harvard medical system could do
Yes.
at that point.
Yeah.
So to be able to show them, in conjunction with my colleagues too. I mean, we have brilliant OTs and PTs and
Yeah.
physiatrists all working their magic, helping reiterate this message. But I think that's part of the power, that I could show them, even in that one session of HRV training, that they did have more control and efficacy, and they could start to change things, change patterns that have been there for a while. And you could just see the difference that made in so many people, to just have a tool that really could do something, and they could see the evidence of it. That's the
Yeah.
beauty of
Yeah.
biofeedback in general, right?
Yeah.
We got the proof. They don't have to talk about that mind body stuff. No, they're seeing the
They're
proof of
seeing
what
it.
they're doing.
Absolutely. It brings that kind of Western mindset
Yes.
into the power of the breath, right? It's amazing. And I'm right in this mindset as well. It's like to see the data just really helps me breathe again, right? The
Yes,
next day,
yes,
and keep that motivation
yes.
up. And it just like it still breaks my heart, like with especially with pain, because I've done a lot of work where chronic pain has been part of additional issues that folks are working with. And it's like almost it sounds like, which doesn't surprise me with our modern medical system, it's like, oh, you've exhausted everything else, so let's try the breath. Like,
Yes,
like,
yes.
because those other things we've tried with pain, and I'm not saying this was it with your folks, but has up and created obviously a huge epidemic in our country around opiates, and just an issue that, oh, you can't give them any medication or treatment. And it's like, we've got this
Exactly.
really great best practice here that is, very affordable. And
Yes,
once we teach them how to do it, and yet it kind
yes.
of, you've exhausted everything else. So now let's use the tool that you do 1,000 times a day, and we're just gonna tweak how you breathe in and out, and kick in
Yeah.
all this research that we know can really address some of the pain issues.
Oh, well said, well said. I mean, and to be able to track their progress over time, because so often with anything, even if, I think even if you're weight training or learning something new, you get lost in the process of learning. You don't realize how far you've come. So
Yeah.
that benefit too. And that they may have been told by other providers along the way, do some breathing. But so few providers have the time to sit and discuss that. It doesn't have to take all that much time, but certainly in a 15-minute visit that a lot of
Right.
people have, they don't have the time to really illustrate that. So to really be able to sit down, have a tool that helps guide someone in learning that,
Yes.
tremendous.
Yes. Let's do this.
Agreed.
And I'm kind of wondering too, like with the expertise that you have developed over years and your training and your I wouldn't say unique, but something that I love your perspective. And I don't think it's unique because I get to talk to other brilliant people like yourself. That's the only reason I don't say that
No.
anymore, because I just like have amazing conversations. I also realize we're the minority in our own profession when we do this. But when you look at ventral vagal activation, heart rate variability, just sort of like where does it fit in when you're maybe working with somebody for the first time? Kind of when do you introduce it? How's it informed your clinical thinking?
Yeah. It's funny because I mean, some people will reach out for services specifically
For
because
that, yeah.
for
And do you
I,
find those people are a different personality than others? Is there, or have they just kind of been referred?
yeah, it really depends, Matt, because I think sometimes the word is getting out. I mean, that's the good news,
Yes.
probably in large part to all that you're doing, all the great work you're doing here. So that is encouraging that, even, maybe 5 or 6 years ago, so few people even knew, what HRV was, what
Yeah.
is that, let alone, what it could do. So I do think there's a lot more awareness. So thank you. And so, right, it can really vary. I do find there are certainly people who are data driven, who want that evidence. Also, sometimes even a little more type A, perhaps because they want to compete against themselves, and so
Yeah. I
let's
was
harness
I was
that, I
gonna put
say.
words in your mouth, but I'm not surprised with that answer. So
I'm all for it. But great, we've got something that can actually help. We use
yes.
that as a strength,
Yeah.
and we're going to work to balance things. But
Well, it's something that we haven't really had to offer in psychology historically. I mean, we had our surveys. I mean, obviously, their own self-report on emotions and pain, all
yeah,
that. But we've been, as I like to kind of say, it's like when I did work in HIV or diet, you get lab results, you get concrete numbers. And as
yes,
a therapist, that was, yeah, I could do some depression inventories or this, that, and the other, but I never really trusted them. And they weren't,
right.
I don't know,
They
like
only go so far.
they
They
could
only
only
go
go
so
so
far.
far. And that's what I love about HRV is, oh, it's quantifiable.
Yes, and you can use it in the context of other measures, and
Yes.
and I think too, it's that way to personalize treatment. We're getting someone's individual data in real time and from session to session, even in between sessions. That
Yes.
just adds so much more breadth and depth to the treatment in a lot of ways.
Yeah. Well, that's what I was kind of going to ask is, one of the things that I have, as somebody who didn't get trained, I kind of came HRV initially from the tracking perspective until I met our friend, Dr. Ina Hazan, and
Yeah.
somehow got just the opportunity to work with her, which has been a
Uh,
huge honor. With as I started to look at, knowing like the biofeedback side existed, but I was like, oh, now I gotta go build this expertise next, which was going to take years. It just took one phone call to a very amazing person
yeah.
to allow me to stay as a minor expert in the field when you work with some of the top experts. But I always like to me that integration piece was like around sort of homework for folks, whether they're tracking it or just breathing at their residence frequency. Because all my work, one way or the other, clinically, we're working with, usually more severe, like homelessness or severe addiction, those sort of things, severe trauma, complex trauma is like, I'm working to regulate this nervous system. And yes, I can ask you to journal because as soon as you get a bachelor's degree, you're going to ask everybody in your life to journal with you. But here is like an activity that goes, I think, just one step further. And hey, let's take that ventral vagal parasympathetic to the gym and give it a nice kind workout to strengthen it in between sessions. and just to see that progress, just accelerate, and maybe accelerate to a small, sometimes large degree, but man, the homework that it offers, I think
Yeah.
any health professional is, to me, so exciting.
Yes, yes. Like anything, I mean, the work in between sessions
Yes.
actually really has the most power in so many cases. And so, right, to have this tool, to have, extremely portable and reliable tool, and especially with what Optimal HRV has developed too, I might add, truly, truly. I mean, what something just so portable, so easy to use. The app guides people so clearly. I really love and appreciate that about Optimal in particular. So, that you can feel confident as a clinician that patients are really going to get the clinical benefit from it, not just the kind of uh, gamification of it.
Right.
Not that there's anything wrong with that part,
Right.
but it goes so much deeper. So it's so easy to enhance the foundation that you're laying in the sessions. Hopefully.
I love it. So, are there anything else that we haven't from that? I've got a few follow up questions, but I just kind of wonder if there's anything else clinically that you have seen integrating biofeedback into. I don't. I mean, integration is probably the wrong word. It's been so central to you, but having that as one of your foundations. Let's put it
Yeah.
that way.
Yeah.
Anything else that has been powerful to you in your work over the years that we may have not touched on yet?
Well, you were reminding me of something just now, Matt, which is truly. I mean, I would say I use HRV with the majority of my patients, at least to some extent. So it might even be, just a handful of sessions in the beginning to illustrate some concepts, or to really help them get off on the right track of really knowing how to regulate their breath, their nervous system on their own, or sometimes much more in depth over many weeks of sessions to really fine tune and really help someone apply that then to other environments. So it really truly is a foundation of my practice, even though I'm someone who brings in many tools and
Yeah.
does a lot of different kinds of therapies. And I often give talks on biofeedback in general, to trainees or other clinicians. Um, and I will always say, if they were to ask me in general, I mean, depends on maybe what population they work with. Sometimes there's a couple, there's other types of biofeedback I might recommend first,
Mhm.
but in general, by far, if a clinician were to ask me, well, there's all these kinds of biofeedback out there, which one should I
Yeah.
train and invest in? Hands down, HRV. It is so versatile, so many conditions,
Yes.
physical, cognitive, emotional, so much research to show its efficacy in so many pathways. That's clinically been just really interesting to continue to see the research come out that supports that, and to be able to offer that, spread the word to get more people trained in using this
Love it.
wonderful tool.
And I love you're out there spreading the word for this as
Absolutely.
well, because I mean, I really think that that's where we sort of are with this movement, is how do we help integrate this in, and that's where like the $10,000 piece of office equipment can sometimes, I think, that was my sort of initial perception of, oh, those are those people with a budget, that have that. And even if you, I mean, obviously there's a benefit to that level of sophistication, yet now we also just either complimentary or even for folks to bring biofeedback in, it's not a $10,000 investment. And I think how we utilize that effectively is just a key messaging as more and more people learn about the heart rate variability.
That's such a good point. It doesn't have to be a barrier, and the technology continues to
Yes.
advance in incredible and affordable and portable ways that don't sacrifice the accuracy and precision. It's wonderful. It's a very exciting
Awesome.
time for
Yes, it is.
HRV clinicians. Yeah.
Yeah. And so, my couple follow-ups are kind of more about you and your thinking is, I've been smart enough to realize when I get folks like you on with all this training, this expertise, experiences, how has this impacted you?
Mhm.
I rarely find a biofeedback practitioner that doesn't hook themselves up from time to time. So you're obviously in mental health. You're dealing, emotions can be contagious, and we a lot of times people see us because they're struggling. So I just kind of wonder, when you think about your own health, your own wellness, as an integrated whole person. How has HRV biofeedback informed your thinking or your practices personally?
Oh, it's such a great question. It's such a great question because, first, just right. I strongly believe. I mean, we have to practice what we preach and kind of walk the walk. So, if we're not having our own practice in some form, then the ability to really share that and communicate the values, and also even troubleshooting or
Yeah.
how to get beyond certain challenges that come up, it falls flat if we don't have our own experience and practice, and if we don't also, as clinicians in particular, we've got to be filling our own cups so that we have more to give. And burnout is such a big risk factor in this profession, among others. So, the ability for HRV to really just help with resilience and balance and well-being in general, even if one is not targeting a specific issue, it just is so incredibly important. So yes, I do my own practice. I actually carry the HRV device in my purse. So if something comes up where someone else needs it or I have it with me for just a moment, it's
Love
it's
it.
so portable. Why not? And
I love it.
we've always got our phones with us, or I do anyway. So we've
Yep.
got the app available. So it helps keep me able to be navigating where I need to be and showing up as best I can as a human and a clinician, ideally.
I love it. So I wanna go into the future time machine here.
Ooh.
As you've been looking at this, in the field now training others to come into the field. I just love, as you've seen it progress over the last several years. Where do you think, when we connect for another podcast, episode 2086 of the Heart Rate Variability Podcast,
I love
five
it.
or 10 years from now, where do you see this technology taking us? What are just some of the, as you look into the future, what might we be thinking about or using 5, 10 years from now, as we kind of hit this rapid evolution of biometrics and biofeedback, as you said, being more accessible to more people?
Yeah, it's so exciting to think about. I can't wait to see. Truly just the portability. I mean, and the access to other wearables in general, right? I think there's a more openness and awareness given other wearables that have become more popular and more even accurate and precise too, so that people are, I think, much more aware and kind of open to this idea of, hey, can we be monitoring these metrics more consistently? And since it's so easy to do and so portable,
Yes.
I expect to see more of that in different forms. And we're already starting to see some of that to some degree, but to be able to, as a psychologist, or certainly my colleagues, within the hospital, within Mass General, where we're sharing a patient working as a team, and we can kind of get some data and get some metrics and see that in between sessions, and kind of then help the patient, with some guidance about what to be working on in between. Certainly, gosh, I think there's just kind of much more integration that could happen, even as a first line treatment. I hope that with more and more really well done research coming out, and more ability and affordability in these products and ways to measure HRV, like Optimal HRV provides, certainly, that hopefully it'll be more of a frontline treatment. Maybe they go to their pain clinic and go home with their own device just supplied by the office, and that is something they are started out on from the start, as opposed to going through a bunch of
Yeah.
treatments or more invasive treatments that maybe aren't, um, don't have to be done if someone can take a different course sometimes. So we'll
Well,
see. We'll see.
yes, I absolutely love that future. And, and again, I just think it's so great. Like people like yourself, being, hopefully I contribute a little bit to getting that word out there, even if you don't go through a week long biofeedback, course, just getting that education out there enough so those that want to go through that kind of certification, certificate or certification can. But how does a social worker or a medical doctor learn how to that this can be part of treatment protocol for those that at least are interested. And like you said, the price now is and again, sometimes we get, very expensive pills for cheap because the insurance market does that. But, why isn't biofeedback part of this? And
Yes,
that just takes a lot of work on our part. So
that's right.
in
More
every single state in the
legislation.
country is the problem. But,
Yes, yes,
we'll,
it's so
we'll,
true.
we'll start it. So,
Looking
well,
forward.
Sarah, this has been an amazing conversation. So I got your website, integrativepsychology.com up here. We'll throw some links into the show notes as well for people. So Sarah, I just appreciate you. I appreciate your work. Like I said, as I introduced you, like this ball of brilliance and joy is that I didn't even see all like the Oxford and the I assume some of that, but it's just a joy to
Very
talk
kind.
to you, my friend.
Very kind note. So wonderful to speak with you again, Matt. And I'm really just delighted to have this conversation and to be part of this, and just so grateful for all the work you're doing and all the great information you're sharing with people. So thank you.
Awesome. Well, as always, you can find show notes and information about Dr. Sarah Gray at optimalhrv.com. Sarah, thank you so much, and we'll see everybody next week.